For this lab, we're going to do cardiophysiology and veins. Okay. When you're listening to your patient's heart sounds, so you use your stethoscope and then you put the head of the stethoscope on the patient's chest. What you're actually listening to is the opening and closing of the heart valves. If you remember, heart valves are like doors or gates that open and close to make sure the flow of blood is one way. So there are four heart valves. You have your aortic, you have your pulmonary, tricuspid, and mitral. So those are the four areas on the chest that you place your stethoscopes on because you want to listen, closely listen to the sounds of those doors opening and closing. So here you go. You have on the right side your aortic valve and tricuspid valve. On the left side, you have your pulmonary valve, and on the fifth intercostal space, you have your mitral valve. So what are the heart sounds? Well, like I said, it's the opening, the closing of your valves. For the first heart sound, the lub is the tricuspid and mitral valve closing. Those two valves are AV valves because they're found between the A and the V, between the atrium and the ventricle. And then the second heart sound, S2, the dub sound, is from the semilunar valves. And we have two semilunar valves, the pulmonary and the aortic, which you will see in this picture, they are side by side. Okay, so let's go to vital signs. The signs of life when you see a patient, there's a few of them, but we're going to talk about two vital signs. The first one is pulse, also known as heart rate. You put your palpating finger on your patient's artery, and then you count the number of beats per minute. In an average adult, the normal is 60 to 100 beats per minute. That's the number of times the heart contracts, which is reflected in your arteries. Anything higher than that is tachycardia, and lower than 60 is bradycardia. But again, it's all relative. I said that's for an average adult. Another vital sign is blood pressure, but we'll talk about that in a little bit. So for pulse rate, also known as heart rate, pulse because you're checking it on an artery, and heart rate if you actually put your stethoscope on the apical pulse. This is the location of the apex of the heart. You could put your stethoscope there and count the number of heart sounds or beats per minute. That's your heart rate. Or even put your palm on the patient's chest, and you would feel almost like the heart banging against the chest wall, and you could count that. And that is the apical pulse. Aside from the apical pulse, your other pulse points would be anywhere where you actually have a large artery. Your carotid, you use that when you do check for consciousness before you do your CPR. Your brachial, we usually use that for pediatrics because the radial or the one on the wrist is too small. There's femoral, there's pedal. Those are where you could check the pulse of your patients. Okay, now let's go to blood pressure. Okay. Blood pressure is what we use to get the blood to the lungs, brain, heart, and even the heart muscle itself. So blood needs a force, and that force is coming from the heart so that blood can flow. There are many factors affecting blood pressure: the heart rate, your cardiac output, the amount of blood the heart pumps in a full minute, affects blood pressure. Your vasomotor control, if your vessels are open or dilated, or closed or constricted when they are narrowed, that will change the blood pressure. And the blood volume. Too much volume will increase blood pressure because that's too much work for the heart. And too little blood volume, especially if you have lost a lot of blood or fluid from diarrhea, sweating, blood loss, that will bring down blood pressure. So these are your blood pressure numbers. And speaking of number, there will be two. Systolic, the upper number is when the pressure when the heart is contracting. So that is a higher pressure because compared to diastolic, when the heart is relaxing, obviously the force or the pressure is lower. The normal blood pressure is less than 120/80. That would be 119 over 79 and below. And then 120 over 80, which is the one we always hear as normal, is actually considered borderline hypertension already. And then you have stage 1, stage 2, and then you have your hypertensive emergency crisis. Now note that these numbers are all relative. So you could have someone whose blood pressure is, say, 130 over 70. So you may see it as high systolic blood pressure, but some people may be normal with that blood pressure. And then you might see someone whose blood pressure is 80 over 50, could be an 18-year-old petite female, one might say that is low or hypotension, but for that particular individual, that may be considered normal. Okay, so these are standard numbers from the American Heart Association, but again, it's all relative. You have to consider the patient as as a whole. So how to take blood pressure? This image shows you an aneroid blood pressure. Let's see if we have some digital sphygmomanometers in the lab. There's a procedure in your laboratory manual, but I also typed up a simplified procedure for taking blood pressure. Please make sure you review each of this, the standard way or the shortcut way that many of you will probably end up doing later on a busy, clinical schedule. Okay, let's leave heart, sounds, blood pressure, and pulse, and we go to our blood vessels. Once again, there are 3 types of blood vessels: arteries, veins, and capillaries. We're done with arteries. That was 2 labs ago. Okay. Now, generally speaking, if there is an artery in the body, there will be a corresponding vein located next to it with the same name. So if there was a renal artery 2 labs ago, there's a renal vein. If there is a subclavian artery, there's a subclavian vein. If there's a femoral artery, there's a femoral vein. Okay. So I have here a similar image from the artery list, except it's blue. And again, the names are pretty much the same with a few exceptions. Like, you'll find out what those exceptions are when you start labeling these diagrams. You are provided with a vein list that you could find on Canvas to help you label these diagrams. Okay. And then in addition to labeling that diagram, please make sure you visit our torso models, because those are the ones you will definitely see in the next practical. And you're going to find the following 11 veins on the lab models. And that's it. It looks like there's not much of an activity, but there's a lot of questions that you're going to do. Oh, the blood pressure and pulse, you'll have to do that in different conditions, with your patient or partner resting and exercising and sitting. So yeah, there's quite a bit of activity for today. And if you have any questions, Martha will be there, our TA, but feel free to email me as well. Have fun today, guys. Bye.